This is despicable.
And it's all preventable.
Welcome back to The Source. With deaths from COVID-19 in Ontario nursing homes now above 3,300, an online forum was held last week to give a voice to families impacted by the crisis. The emergency town hall meeting was organized by our next guest, Maureen McDermott. Maureen, thanks for joining us, and very frustrating times here. You are a very well-spoken activist for the situation in long-term care homes. One of the things that you would like to see is the military stationed in Ontario long-term care homes to get a handle on the situation. You're frustrated it's not happening.
Oh, I'm very frustrated that it's not happening. And pretty much everybody in Ontario is frustrated that it's not happening. And in fact, the timing of this interview and the timing of our campaign is perfect, because Doug Ford was asked the direct question today: why have you not called in the military, specifically to Roberta's place, but to all of these other places that are absolutely exploding right now? And his answer: I was told not to. And then it was diverted onto airports, travel, and churches. So again, we have no answers, being silenced.
Bill 203 has been proposed. How will this help things out?
Well, you can imagine if you had a loved one in long-term care and you were locked out from actually seeing them. You were locked out from communication. Some of these families have actually had to say goodbye to their loved ones through dirty windows, through broken Skype calls on tablets. It's unimaginable what thousands and thousands and thousands of us are going through. Bill 203 is more than a Visitor Act, would guarantee those meaningful connections that we need to have with our families in all congregate settings. There's children in congregate settings that haven't seen their parents. It's not just long-term care that Bill 203 would take care of.
Maureen, when the vaccine finally arrived here in Niagara, priority was given to people working and living in long-term care homes. Are you happy with the rollout of the vaccine here in the region?
No, it should have been, those needles should have been in every single arm, like well over a month ago. As soon as they got off that plane, they should have been getting those in, and they weren't. And from what I hear from the Ontario Health Coalition, there's still 130 sitting in a freezer. It makes zero sense. If we had had those in any of the long-term cares that are in outbreaks right now a month ago, we wouldn't be dealing with them. We wouldn't be dealing with this ridiculous ticker of counting dead bodies that's happening daily. We're at the point now where it's on the average, one senior citizen is dying from COVID per hour right now.
You use a term that really puts it into perspective. Senicide, is that how you pronounce it?
Mm-hmm. It really does. I mean, the definition of it basically means allowing seniors to just falter and die. And that's exactly what's happening. We've had reports from long-term cares where residents are calling 911 to be fed because they're thirsty, because their diapers are soiled. That is senicide. They are dying. People have been dying in beds and discovered that they've passed, and they don't even know how long it's been. So those people are dying alone, thinking they're abandoned by families and that they've been completely let down by their government.
You originally planned to drive by to show support for seniors. It turned into the town hall. It was attended by the media, attended by 3 of the local MPPs here in Niagara. Was the turnout what you expected?
The turnout was fantastic. Our responses, we had over hundreds of thousands of people retweeting on Facebook, watching the live town hall, and about so many others watched it afterwards. And it really got a lot of attention. And the videos that were submitted were absolutely mortifying. We still haven't been able to count the amount of videos that come in, because it means having to see them, and we just can't. The human emotions, the human soul just can't take on that kind of tragedy. There was so many.
Have you had support from people working in the long-term care homes?
We have. It's unfortunate what's happening to so many of these staff that are speaking out. They're getting terminated. They're being treated poorly. So it's a real fear. We definitely need protection for these whistleblowers because we need to hear from them more often. But I will let you know that they are speaking up confidentially, anonymously to us. We are hearing them because we are the voices of long-term care. That doesn't stop at residents and residents' families. That's all encompassing.